All right, Commerce and Labor will start. First thing we'll do is we'll deal with the bills that need to be...
Mr. Chairman, I think we have to take the roll.
Right. Vote aye if you're here. No if you're not.
Mr. Chair, you have a quorum.
All right. First bill, the first part of the agenda will be bills to be re-referred. The first is 1832. That's Subramanian's bill, and that goes to transportation. So do we need to record it? All right.
That's 14-0.
All right. Next is HB 1884. That's Sickles' bill, and that goes to Finance and Appropriations right off the bat. Is there a motion? So moved. All right. It's been moved, seconded that we re-refer House Bill 1884 to Finance and Appropriations.
That's 14-0.
All right, next is House Bill 2250, K. Corey, Delegate Corey. That goes to Agriculture, Conservation, and Natural Resources. I need a motion. So moved. Moved and seconded that we send HB 2250 to Agriculture, Conservation, and Natural Resources.
That's 14-0.
Thank you, Mr. Chairman. It's nice to be here, even.
We just referred your bill.
I know, I was watching.
Okay.
I'm just thanking you. Okay.
All right.
Good afternoon.
Okay. Have a good day. House Bill 2269 is Delegate Herrick's bill. Also goes immediately to, initially to Finance and Appropriations. It's been moved. I need a second. That 2269 be re-referred to Finance. Okay.
That's 14-0.
All right, now we're going to bring up identical bills. All right. House Bill 2034, that is identical to Senator Edwards' bill that passed here 15-0 in committee and 39-0 on the floor. Hold on, let me get to that. Right, that's, yeah, third-party power purchase agreements. Okay, we're going to need a motion. All right? It's been moved and seconded that House Bill 2034, Delegate Hurst, which is identical to Senator Edwards' bill, be reported. All those in favor, say aye. Vote aye. All those opposed? All right.
That's 14-0.
All right. The second and final identical bill is that of Delegate Hudson. That's HB 1896, and that is similar to Senator McClellan's bill, and hers was 1276. And it passed out of committee 12-2, but was 2017 on the floor. And that's 1896. And that was the one that allowed them, didn't mandate it, but it allowed on the exchange to offer abortion coverage, to refresh your memory. Move to report. All right, it's been moved and seconded that 1896 be reported. It's similar to Senator McClellan's bill. All those in favor, vote aye. Opposed, nay.
Ayes 12, noes 2.
Okay, bills reported. All right, next we get to similar bills. All right, the first is Delegate Heretics 1818, and that is similar to Senator Marsden's bill. And that dealt with the presumption of compensability for certain diseases, and I believe that it was for occupational disease, for death caused by hypertension or heart disease, for salaried or volunteer emergency medical service personnel who have at least 5 years of service and are operating in a locality that has legally adopted a resolution declaring that it will provide one or more such presumptions. Any comment on that? It's similar, not identical.
Mr. Chairman.
Senator Newman.
So I guess to either the patron or Senator Marsden, we amended your bill in here. How does this differ from your bill that we
Correct.
fixed in here?
I'm not quite certain. I think what we need to do is conform and then work it out. Would that make sense?
Mr. Chairman, if the council could report the differences, sir.
Mr. Chairman, Senator Newman, Delegate Heretics bill does not include the meets any minimum hours worked requirements amendment that this committee put on, as well as an amendment from Senate Finance and Appropriations that said the provisions of this act shall not apply to any individual who is diagnosed with hypertension or heart disease before July 1, 2021.
Yeah. Conform it. Mr. Chairman, I move to, that we conform Delegate Heretics bill to our version of the bill. There's a significant enough difference here that, we probably need to talk this over.
All right. All right, you've heard the motion. Is there a second? Second. All right, it's been moved and seconded that we conform Delegate Heretics bill to Senator Marsden's bill. All those in favor say aye. Aye. All right, bill is now before us. All right, there's been a motion and a second to report House Bill 1818 as amended. All those in favor will vote aye. Those opposed, nay.
It needs to be re-referred.
To Finance? They want it? Okay. So the motion will be to report and re-refer to Finance.
Ayes 15, no 0.
Okay. Next is House Bill 1834, Subramanian's bill. I hope I'm pronouncing his name right. That's Senate Bill. That's House Bill 1834, and it's similar to Senator Deed's bill, which passed out of here 14-0, and then on the floor 39-0. And that calls for, I think, that was. You got to notify local jurisdiction within 30 days of making a decision to shut down a carbon-emitting power plant. And you provide to the relevant localities and state agencies about the decision to close it. The bill requires localities and such in public hearings regarding the impending closure 6 months. Okay. The Division of Energy will maintain a public website listing this. Are there any other questions?
Mr. Chair, that's about right. It's mainly a notice bill, just requires notice.
So it's just the 30-day provision?
30-day notice is all it is.
Yeah, okay. All right. You want to conform it or what?
I like their version better, honestly. But I think we put an amendment on it over in the House to exempt out a plant that's already given notice down in Giles County. I don't know if we have that language, if staff has that language.
So you want to leave his bill as it is? Is that what you're saying?
I think staff may have one amendment that came from
All
the
right.
House.
Okay.
Mr. Chairman, Senator Deeds
Mr. Stevens.
should be available online shortly, but After line 65, insert H, notwithstanding the provisions of subsection A, the provisions of this section shall not apply to any electric generating facility that has a nameplate generating capacity of 90 megawatts or less and that filed a deactivation notice with PGM Interconnection LLC prior to September 1, 2019. Mr. Chairman, I would note there would also need to be a couple technical amendments to Delegate Subramaniam's bill on line 17, how it refers to subsection E of 10.1-1308 needs to be fixed.
I'm not sure, Mr. Chair, I'm not sure about the technical amendments, but I assume that's all right. But the one amendment that he described basically involves a plant in Giles County where notice of deactivation was given late last year, and just to take this out of the bill. There are no employees at the plant, and they're shutting down.
Okay.
So I move to adopt the amendments.
All right, there's a motion and a second to adopt the amendment. All those in favor of adopting the amendment, say aye.
Aye.
All right, opposed? All right,
Move to report.
okay, there's been a motion and a second to report 1834 as amended. All those in favor vote aye.
Ayes 14, no zero, one abstention.
All right, bill's reported. The next bill is Delegate Ayala's bill, and that's similar to Senator Edwards' bill. That's 1334. Is that 1334? Yeah. And Ayala's bill is House Bill 1923. And
Mr. Chairman.
that's the broadband capacity bill.
Yeah, good bill.
Mr. Chairman.
Yeah.
Yes, sir.
Stevens.
The only difference between the two bills is Senator Edwards' bill fixed a couple grammatical mistakes that weren't fixed in Delegate Ayala's bill. So to conform, it would take two amendments to fix those mistakes.
I move the fixed amendments.
All right. A motion and a second to adopt the amendments. All those in favor say aye. Aye. Opposed? All right, the amendments are adopted. Action on the bill. All right, motion to
Mr.
report.
Chairman.
Move to report your bill.
Senator Newman.
Mr. Chairman, is this a bill that is maybe council knows? Is this a bill that relates to LS Power also?
Mr. Chairman, it relates to the Roanoke Valley Broadband Authority and other similar authorities.
Mr. Chairman, thank you. I'm good. Thank you.
Yeah. All right, bill's before us.
The report is amended.
Motion to report House Bill 1923 is amended. All those in favor, vote aye.
Ayes 15, no zero.
Bill is reported. The next bill is also heretics. That's House Bill 2008, and it's similar to Senator McPike's bill, which passed here 15-0 and 39-0 on the floor. So 2008. That's authorization. That was the authorization of drugs prescribed for treatment of mental disorder.
Move to report.
Are we going to, you want to leave it as is?
I'm sorry.
Mr. Stevens.
Mr. Chairman, the difference between the two bills is Senator McPike's bill applied to the state employee health insurance plan, whereas Delegate Heretic's bill does not. If you wanted to conform, you could adopt a substitute to do that.
Does that send it to Finance Committee, or have they requested it already? All right, well, we'll adopt the amendment and see what happens.
Mr. Chairman, I move this is Senator Eben, I move that we conform it to the Senate version.
Does that include the state plan? Okay. There's been a motion to, by Senator Eben to adopt the amendment That brings it in the state plan. All those in favor say aye. Aye. Opposed? All right, the amendment's adopted. The bill is now before us. You have another amendment? Okay.
Second.
All right, been a motion and a second to report House Bill 2008 as amended. All those in favor vote aye. Opposed?
Ayes 15, no zero.
Okay. All right. The next bill is House Bill 2032. That's Senator Goditis. And that provides individuals who are engaged in providing domestic service are not excluded from employee protection plans. And I think that was similar to Senator McClellan's bill. That was 12-3 in committee and 21-18 on the floor.
Is that
They're not
the same as?
Yeah. Did you want to speak, Mr. Stevens?
I was just asking if it was the same as,
Senator Evan?
if it was the same as Senator McClellan's or if it differed.
It's similar.
I would move that we conform it to Senator McClellan's version.
Second.
All right. There's been a motion and a second to conform House Bill 2032 to Senator McClellan's bill. All those in favor, say aye.
Aye.
Opposed? All right. The bill is now before us.
Move to report.
A motion to report. Is there a second? Second. Mr. Stevens? I can't hear you.
Amend my motion to report and refer to
Report.
finance.
Okay. Don't go anywhere with that. All those in favor of reporting and referring to finance, vote aye. Those opposed, nay.
Ayes 12, noes 3.
All right. The next bill is House Bill 2207. That's Delegate Jones. That's similar to my bill 1375. You remember that was the bill that added to the presumption for, I think it was for COVID-19 to fire and emergency, and we added, I think we added prison guards to that in my bill, and we would conform his bill to mine, and then I would suggest another amendment as well to add regional jails to this. So first I need a motion to conform his bill to mine. All right. Now, that having been done, I would then move to amend it to include also regional jails.
So moved.
All right. Does this now have to go to finance? I think it does, yes. All right. The motion would be to report and refer to finance. Oh, the other difference, his bill would, by conforming it to mine, my bill, if you remember, was prospective, and the statewide cost was only 2 or 3 million. If I remember from last year, when mine was retroactive, the cost was astronomical. So his bill, in conforming it to mine, makes it prospective after July 1st. Okay? All right.
Mr. Chairman, did we vote to conform and to adopt the amendment?
No, we just voted to conform. I think we did vote to conform.
Not the second one, Mr. Chairman.
But the second one we didn't do yet. So I would need a motion
I move the amendment.
to adding regional jails. Is there a second? Second. Okay, and it remains prospective. All right, all those in favor, and by the way, on the floor, mine passed 39-0. It was 15-0 here. All right, all those in favor of reporting House Bill 2207 as amended and amended again. Vote aye. Those opposed, vote nay.
Ayes 15, no 0.
Okay. The last of the similar bills would be House Bill 2304. That is similar to Senate Bill 1413. Now, that was Senator Boysko's bill. I think it had to do with broadband. That bill, Boysko's bill, passed out of here 12-3 and 28-7 on the floor. So, first of all, any questions? And I would then need a motion to conform.
Mr. Chairman, I would move to conform House Bill 2304 to Senator Boysko's Senate version.
Second.
Okay. You've heard the motion. All those in favor say aye. Aye. Hold on, let me turn to 2304. 1 second. Okay. All right. All right. Now there's a motion now to report as amended, which conformed House Bill 2304 to Senate Bill 1413. All those in favor, vote aye. Okay.
Ayes 15, no 0.
All right. Next will be the Energy Subcommittee report. And I would yield this time to Senator Spruill.
Thank you, Mr. Chairman. So we're going to go straight down the line, if you don't mind. And the first one is House Bill 1907, Electric Utilities and Advanced Renewable Energy Buyer. Electric is provided that certain accelerated renewable energy buyers that are customers of Dominion Energy Virginia and has subscribed to as of March 1st, 2021. However, the exemption is based on the amount of renewable energy certificate associated with the customer's renewable facilities agreement associated with the offering in proportion of the customer's total electric. The bill was reported to the committee and we was recommended approval 5-0.
All right, you've heard the, and is there a motion?
Not so moved, 5-0.
There's a motion and a second to report House Bill 1907, Delegate Sullivan's bill. All those in favor, vote aye. Opposed? Nay.
Ayes 15, no 0.
Thank you, Mr. Chairman. The second one, next one is House Bill 1914. It's electric utilities triennial, how you pronounce that word, triennial review per cost rating. That was a substitute, Mr. Chairman, after the committee have heard the bill, and the substitute was not put before the committee, so the committee recommends 3-2 to PBI, the bill. So I move that it be PBI.
Substitute motion, Mr. Chairman. Substitute motion.
Senator Marsden.
Thank you. I move that we PBI with a letter referring this to the Commission on Electric Utility Regulation.
And a second.
I would just tell you, having been on the Utilities Committee, having been on the Electric Utilities Commission since its inception, it's really essentially you're talking about the staff being our commerce and labor people.
Mr. Chairman, you got a motion on the floor.
I know, and I would hope that you would vote against this, but vote for the motion, a substitute motion, or after this to just plain PBI it. So the motion before you now is to PBI it with a letter. I'm telling you, I don't see where that would do any good at all, and I would ask that you not vote for that.
Mr. Chairman, on behalf of the chairman, I'll be glad to preside and let you make your motion if you have one in your comment.
I will.
And
You
Senator Spruill should be looking at me too, because we went through this drill.
All right.
Chairman?
You've heard.
Mr. Chairman, I'm not clear which motion is on the floor and a letter to whom.
Marsden's is to PBI with a letter. Mine, if this does not pass, will be just plain PBI.
Mr. Chairman, you can't do that. You have three motions. You can't have three. I made the first one. He made the second one. You can't have a third one behind that one.
Your first one was the PBI.
That's right.
Okay. All right. If that, then we go back to his motion. Okay. You've heard Senator Marston motion to PBI with a letter. All those in favor, vote aye. Opposed, nay.
Ayes 5, noes 10.
All right. The preliminary motion is now before us, and that is to PBI the bill, period. All those in favor, vote aye. All opposed, vote no. Oh, mine's not, oh, there you go.
Ayes 8, noes 7.
Ayes 8, noes 7, the bill is PBI'd.
Thank you, Mr. Chairman. The next one is House Bill 1925, Virginia Brownfield and Coal Mine Renewable Energy Grant Funds and Program. Mr. Chairman, to establish the Virginia Brownfield and Coal Mine Renewable Energy Grant Fund and fund. This bill provides that no allocation of the funds should be made to the funds of the program unless a federal funds are available to cover the cost of such action. It was recommended by the committee to report. I move this bill be reported and referred to finance.
All right, you've heard the motion. Is there a discussion? All right. Is there a second?
Second.
Second. All right, the motion will be to report and refer to finance. Ready to vote?
Ayes 15, no 0.
Thank you, Mr. Chairman. The next, Mr. Chairman, is House Bill 1965, State Air Pollution Control Board Low Emission and Zero Emission Vehicle Program. It's by Delegate Bagley. Mr. Chairman, there's an amendment. I believe Delegate Bagley is in the tube.
Yeah, I'm here. The clerk has that amendment.
Please.
Maybe want to ask council to report it.
Mr. Chairman, Senator Spruill, Delegate Bagby, the subcommittee recommended a few amendments, and then Delegate Bagby is offering an additional amendment, which should be online shortly, but the amendment would establish a zero-emission credit program in which manufacturers could earn zero-emission vehicle credits to which they could sell or trade or apply up to 18% of their requirements in any model year.
Mr. Chairman, I move the amendment.
All right, you've heard the amendment.
You've got a second,
All those
Mr.
in
Chair.
favor of adopting the amendment, say aye.
Aye.
Aye. Opposed?
Mr. Chairman.
Okay, and the amendments that the committee, amendments adopted, the amendments in subcommittee?
Mr. Chairman, with that, the committee recommended 4 to 1.
Oh, okay.
The committee recommended 4 to 1 with the amendments, recommended 4 to 1 to approval. Am I missing something?
No.
Mr. Chairman, Senator Spruill, I guess I just didn't hear you. Did you adopt the subcommittee amendments?
Yes, sir.
Yes.
Yes, sir, I did that first.
Mr. Chairman,
Senator Newman.
just before we do this, I know a couple of states have done this, but I make no mistake about what we're about to do is we're going to turn our air policy over to California, and whatever they do is going to be cool with us. And I'm just not okay with that. I think that's bad policy. They're right now in the middle of a rulemaking there. We have no idea what they're going to come up with, and we're making a decision here right now that we're going to be okay with whatever they do. And I just, Mr. Chairman, I've been in this legislature a long time, never thought we would do that, and I hope we will not.
I would just say, Senator Newman, one of the concerns that I have about moving to a system similar or somewhat similar to what they have is that they've had two major utilities go bankrupt in the last 21 years, and they've had numerous brownouts there. So anyways, the motion before you.
Mr. Chairman, we have since that you and Brother Newman have spoken, we do have some people in the queue. We have everybody in the queue to speak.
Can they speak at the subcommittee?
I believe if they are, anybody new, Tom? If nobody new, Mr. Chairman, then the committee voted 4-1 to approve of the amendment.
Okay.
Mr. Chairman.
Senator Norman.
Mr. Chairman, a question to anyone. We've repeatedly made reference to California and basically adopting their policy and potentially abdicating any changes to California. Does the amendment that Delegate Bagley offered today change that in any way?
No, sir.
Okay.
Heard the motion to report as amended. All those in favor vote aye. Those opposed, no.
Ayes 11, noes 4.
Ayes 11, noes 4.
Mr. Chairman.
Thank you, Mr. Chairman.
Mr. Chairman, I voted for Senator Deeds, and it showed up at the last minute. I don't know if the clerk saw that or not.
Well, it was 15
He got it.
votes.
He got it.
So,
You got it.
He has it. Thanks, Mr. Chairman. The next bill, Mr. Chairman, is House Bill 1984. 1984, Mr. Chairman, is comparable to House Bill 1914 that we looked at, and the committee voted to PBI.
Second.
The vote was what?
To PBI, the vote was 3-2.
Okay. You heard the motion to pass by indefinitely. All those in favor of passing by indefinitely, vote aye.
Ayes 11, noes 4.
Ayes 11, noes 4.
Thank you, Mr. Chairman. The next one, Mr. Chairman, is House Bill 1994, small agriculture generator definition. Expand the definition of a small agricultural generator to include any business operating a small agriculture generating facility that has been granted a manufacturing license in distillery, limit distillery, brewing, and so on. It was recommended by the committee 5-0 to report, and I so move.
Second.
All right, motion and a second to report. Did you say as amended?
No, sir.
Okay. All those in favor of voting to report 1994, vote aye.
No 0.
Thank you, Mr. Chairman. The next one is House Bill 2048. 2048 is by Delegate Bourne. It's authorized individual retain retail customer to electric energy to purchase electric energy providing 100% from renewable energy from any licensed competitor supply. It was recommended by the committee 5-0 to PBI. I so move.
Second.
All right, it's been moved and seconded to PBI 2048. All those in favor vote no. Or vote aye, excuse me.
Mr. Chairman, can you strike the vote? Mr. Chairman,
Go ahead and strike the vote, Hobie.
Mr. Chairman, we're working with some of the stakeholders in this, and we think we have a good amendment on this. We asked if we could pass it by for the week and try to work that out.
All right. Without objection, 2048 will go by for the week. It's up to the subcommittee chair, actually.
Mr. Chairman, was there at the subcommittee, let me use your words, that you were saying that any of these people speak at the subcommittee? But you were saying, I didn't hear this at the subcommittee, unless something new.
Mr. Chairman, if I could,
Senator Norman.
if I could dovetail on that. First of all, it's very rare that I ever compliment Senator Spruill on anything, but he really did a yeoman's job of working this legislation through the subcommittee, and we considered it. And Mr. Chairman, you've heard me say this before, and this is all due respect to Senator Bell. This is really complicated stuff, and so much of it is interrelated to various bills. And I appreciate the effort to try to work out a consensus, but it is never that simple. And to come up with another approach out of a consensus, which I'm always happy to see, without that subcommittee looking at it again, we could spend a lot of time here with a lot of interested parties, because it is never as simple as it seems. And up to the reconfigurations, I chaired that commission for 15 years, and I still don't know much about it. So I just offer you to...
All right,
Mr. Chairman.
The motion is to PBI.
Mr. Chairman, Surville.
Senator Surville.
I just want to say that I agree. This stuff is extraordinarily complex and interrelated, and there's been lots of policy changes through the years we need to consider, which is exactly some of us would like to see the Commission on Utility Regulation more used when we're not here with a gun in our head and all these other bills going on and decisions to make in short hearings. And so I think that's the perfect forum to talk about these kinds of issues.
And I would agree, but they don't need the bill, they just need the subject. So the motion is to PBI. All those in favor of PBI, and it vote aye.
Mr. Chairman, I think there was a substitute motion made.
Pass it by for the week.
Was there a substitute motion made? You have to do that substitute motion.
All right,
May I speak toward the substitute motion, Mr.
Substitute
Chairman?
motion was to go by for the day.
Yes, sir. Mr. Chairman, may I speak to the substitute motion?
Senator
I'm
Small.
asking the committee, please don't do that. I have a hard time asking questions. And I don't ask, and we try to do it at the subcommittee meeting. But I do think that the person has a right to ask for a substitute. We should vote on the substitute first. I'm asking the committee, please do not support the substitute.
Mr. Chairman?
One of the things, let me just add this. If we keep allowing people to offer substitutes every time their bill is defeated at PBI, we may as well do away with the subcommittee. So that's the problem that I have with doing it that way.
Mr. Chairman, I withdraw the motion. The handwriting on the wall is clear, and I know the great work of Senator, so I withdraw.
All right, the motion's
Senator
been withdrawn.
Sasslaw, Mr. Chairman? Mr. Chairman? Dave?
Marson.
You know, certainly I don't want to see the subcommittee overturned either, but turning something from PBI to PBI with the letter are two different things, and that's really not a great deviation. And I think it's sometimes we need to look at that. It was defeated, that's fine, but it's not inappropriate to do that.
Mr. Chairman, as the subcommittee chair, I'm asking the committee that let's not have a letter with this one. Let's PBI and let's be done with it.
The motion's to PBI. All those in favor of PBI, vote aye.
Ayes 11, noes 4.
Ayes 11, noes 4. It's PBI.
Thank you, Mr. Chairman. The next is 2049. Mr. Chairman, on 2049, it's the customer's credit reinvestment offset. Eliminate customer's credit reinvestment offset under which a utility is allowed upon a request to reduce or eliminate amount of over earnings that otherwise would be required for credit by the customer. Mr. Chairman, when the chair called for a motion, there was no recommendation. Even the chair, Mr. Chairman, relinquished his seat and made a motion, and that would not go through. So this is coming for the full committee with no recommendation. I could not get a motion to PBI. I could not get a motion to pass. Even I tried it myself. So it's now before the full committee, just as it is. I'm just doing my job, to the chairman.
Okay.
So it's supported with no recommendation.
Mr. Chairman,
Senator Norman.
having some familiarity with 2049 when we did discuss it in subcommittee under Senator Spruill's leadership, I would just say, Mr. Chairman, first of all, that, as I read it, it is in conflict with a couple of other bills, and that would be House Bill 2160 and House Bill 2200. And that's one part of it. There was some duplicity of the approach that was in, I think, Bill 1984. Is she the young lady from Charlottesville?
Yes.
Hudson. There was some redundancy that appeared in both of those bills, and we did not act favorably on 1984.
All right, is there a motion to either report or PBI?
Mr. Chairman, Mason.
Senator Mason.
Thank you, Mr. Chairman. Before we move on, I want to take the opportunity to piggyback on what Senator Norman just said and point to Senator Serval's request that some of these things, I realize y'all spend years on this commission, but if you voted for the Grid Modernization Act, this right here is a critical component of it. And hundreds of millions of dollars came going to offshore wind, also going to modernization of the network, of the infrastructure, as well as some of the payment forgiveness that it came from this section. So I just want to take this chance to say this is a tough committee. The last bill, last year we had 20 people line up saying this is deregulation, and 20 people line up saying no, this isn't deregulation. So it is my hope that, like with Senator Serval, we can send this something in the off season. We can have these extended conversations. I realize you've had them, but Senator Norman just pointed out several of these bills that all passed and got sent over here are in conflict with each other. So we'd have to sit down and decide which ones we liked and which ones there's no way we could pass them all.
Well, you want to let this go by for the week?
No, sir. I don't. I just want to suggest that, again, we are embroiled in incredibly complex matters here, and I think we've got to figure out a mechanism in the off season that we can delve into these things deeper.
Who's chair now of, huh?
I think Senator Serval would be great, Mr. Chairman, but thank you. I appreciate the time to speak.
Mr. Chairman, I used to be chair of it, and maybe even if we pass this by, I think that a concept, not necessarily a specific bill, but a concept on some of this could be sent to that commission to look at it, and I think it's pretty important. There's no way that we can, in spite of the brilliance of everyone on that side of the room, to go through and analyze these bills and reconcile them. I just don't think we could do it, and it's not something that's going to happen at a single
I'm going to
meeting.
draft up a letter containing subject matter that the Electric Utilities Commission should look at this during the off-season.
Yes, sir.
Okay?
Take those
All right.
Mr. Chairman, I'd a whole lot rather them look at the last bill than this bill, because this is incorporated in the Grid Modernization Act, and if you supported that, you're hard-pressed to dismantle this critical component of
You
it.
can look at both of them.
Okay.
Mr. Chair.
Yes, sir.
Mr. Chairman, we do have the patrons would like to say something.
You know, take at 2048 and 2049 and draft up a letter. Go ahead and send it to me, and I'll call a commission meeting. Is that okay with the other members here?
But Mr. Chairman, also in that letter, and excuse me for interrupting, they need to take a look at these other two bills, which are 1914 and 2200, because there's an inherent conflict within these three bills.
Okay.
Mr. Chairman, we do have the patron would like to say something. Jeff, is you there? You there, Jeff?
I'm here. I was just here to answer any questions or offer any insight, perhaps correct some misconceptions about the bill. But,
did you hear what the chair said as far as taking those two bills together and have a letter?
Indeed, I did, Senator.
Three bills.
Three bills. I'm sorry. You okay with that?
I'd much prefer the bill to pass out of the Senate, but I understand. I understand the Herculean task that would be, and so it is what it is.
We're trying to throw your bone with some sugar on it.
No, I understand. I understand. But sometimes ain't enough sugar in the world to make that go down nice.
Yes, sir. Mr. Chairman, to Senator Norman, what was those three bills that you?
Well, Mr. Chairman, what I was saying is there's some common principles, even though they may be worded a little differently in Hudson's Bill 1984 and Delegate Burns' Bill of 2049, but they cannot
Bourne.
they cannot
Bourne.
they cannot ignore 1914 and 2200 is what I'm saying.
Okay. So, Mr. Chairman, so that because 2200 is coming up, so could we just put those together, Mr. Chairman, in your letter? We won't have to hear that then. It's all the
All right,
same.
go ahead.
Okay, Mr. Chairman, so Senator Norman, we were given those numbers again, and we put them all together, was 2049, 2200, which is by Delegate Jones, and what's the other one?
Well, there's the Hudson Bill 1984. There's a current bill we're dealing with, 2049, and then 2160 and 2200.
Okay, Mr. Chairman, then, so we could save time, Mr. Chairman, we take those bills. Tom, if you would call those names out, those bills out again, and then we would put those together, please.
Mr. Chairman, Senator Spruill, I believe Senator Norman referred to House Bill 1914 by Delegate Helmer, House Bill 1984 by Delegate Hudson, House Bills 2048 and 2049 by Delegate Bourne, House Bill 2160 by Delegate Tran, and House Bill 2200 by Delegate Jones.
I did not mention those. I did not mention Helmer's bill, a 1914, or Tran's bill.
My apologies, sir.
Mr. Chairman.
Mr. Chairman, so we're talking about 1984, 2048, 2049, and 2200.
Mr. Chairman.
What a minute.
Senator Newman.
Mr. Chairman, wait a minute before he speaks, Mr. Chairman. I want to make sure that we don't want to call it before we go to another subject. The four that Senator Norman was talking about, that we will take those, Mr. Chairman, in your letter. And I so move.
All right, motion and a second. Senator Newman.
Mr. Chairman, is it possible to remove House Bill 2200?
Sure, it's possible.
Mr. Chairman, I would hope that we let 2200 stay in, because if you can do 2200, you might take all the rest of them out.
That ain't a bad idea either.
That's true. That's true. But it's
All
not.
right, we'll leave 2200 in.
So, Mr. Chairman, so 1984, 2048, 2049, and 2200 was a letter coming from the chairman. So move.
Letter will be prepared by Mr. Stevens.
What do we do with these bills?
Yeah, we're going to PBI. All right, the letter from the chair is going to come on that.
All right.
We're going to. Is there a motion to PBI 2049?
So move, Mr. Chairman, with
All
the
right.
letter.
All those in favor of PBI and 2049, say aye. I vote aye.
Ayes 11, noes 4.
All right.
Mr. Chairman, to save time, Mr. Chairman, House Bill 2160, Mr. Chairman, was recommended by the committee to PBI 3-1, and this is the one, Mr. Chairman, that we recommend to roll into this letter that you were talking about.
All right.
No, it was. I apologize. Not. It's separate, Mr. Chairman, by itself. What had happened that 2160, Mr. Chairman, provides that the State Corporation Commission may, in any interim review, establish a range above or below the authority rates of returning, such as if the combined rates return on common equity earned by generation and distribution service within the range. So it was voted on by the committee 3-1 and one abstain to PBI.
And you so move?
So move.
All right. There's a motion to PBI 2160. All those in favor, say aye, vote aye.
Ayes 12, noes 3.
All right. Next one, Mr. Chairman, is House Bill 2200. That's the bill, Mr. Chairman, that was recommended by the committee, 3-1 to PBI, and I believe that's the one that we're adding to the letter that you were talking about. It was so moved by the committee.
All right, you've heard the motion. Is there a second? PBI. All right, the motion and a second to pass by indefinitely.
Mr. Chairman, this is with the recommendation that in the letter now, right? That you were talking about.
That's one of the ones that'll be included.
Yes, sir.
Ayes 11, noes 4.
Thank you, Mr. Chairman. The next one, Mr. Chairman, is House Bill 2282. State Corporation Commission, Transportation Electrification Utility Recover of Certain Costs. Direct the State Corporation Commission to report on policies proposals to accelerate transportation electrification in the Commonwealth. The bill requires that the Commission to submit no later than May 1st, 2022, report to the General Assembly recommended by policy proposal that will govern policies on utilities. It was voted by the Commission to report 5-0. I so move.
Second. Motion and a second to report 2282. The subcommittee recommendation was 5-0. All those in favor vote aye.
Ayes 15, no 0.
Ayes 15, no 0. The bill is reported.
The next, Mr. Chairman, is 2330. Mr. Chairman, on that 2330, Mr. Chairman,
I think
the vote was 3-4 and was no no one to vote against it. But the chairperson, Delegate Corey says that they got some more work to be done on this. They asked this to be passed by for the week to next meeting.
Okay.
And there was no objection but to pass it by.
All right.
And I so move.
Okay. Well, that completes the energy.
We got to vote on it.
All right. Without objection, the bill will go by for the week.
Okay.
All right. That completes the Energy Subcommittee. We'll start now on the insurance bills. That's 1807. Is Delegate Kilgore there?
Yes, I'm here.
Okay. You want to
Thank you,
explain
Mr.
your bill and why you think we need it?
1807, Mr. Chairman, comes from the State Corporation Commission, and it updates the provisions of the Code of Virginia related to insolvency procedures for HMOs. Back in 2018, we put the HMOs under the Virginia Life Accident and Sickness Insurance Guarantee Association, but we failed to bring forward some of the insolvency language. So this is necessary to make sure that it is consistent.
Okay. Are there any questions of Delegate Kilgore? All right. Any discussion by the committee?
Move report.
All right. There's a motion and a second to report House Bill 1807, Delegate Kilgore's bill dealing with HMOs and the insolvency provisions. All right. All those in favor vote aye.
Ayes 15, no 0.
All right. 15-0. The bill's reported. Next is House Bill 1822. That's Delegate Askew's bill.
Mr. Chair.
Has to be, and by the way, the motion, if we report it, it has to go to Finance. Delegate Askew, you want to explain your bill and why we need it?
Yes, Mr. Chair, members of the committee, I believe I have a line amendment.
Yes, Mr. Chairman, Delegate Askew, it should be available online shortly, but it's line 18 engrossed after any strike individual or group. On that same line after health, insert benefit. So it would read health plan means any health benefit plan as defined in.
All right, you've heard the amendment?
Move
All right,
to accept the
is there a
amendment.
motion to accept the amendment?
So move, Mr. Chairman.
All right. Somebody? Senator? Okay. All those in favor of adopting the amendment to 1822, say aye.
Aye.
All right. Go ahead, Delegate Askew.
Thank you, Mr. Chair. And the amendment just strictly clarifies the definition for enforcement purposes. But the bill HB 22 prohibits health insurance companies and other carriers from setting amount exceeding $50 per prescription for asthma inhalers. These are specifically for Tier 1 and Tier 2. We worked this out on the House side that a covered person required to pay at the point of sale in order to receive a covered prescription for said inhalers. The measure also prohibits a provider contract between a carrier or its pharmacy benefit manager and a pharmacy from containing a provision that authorizes the carrier's pharmacy benefits manager or the pharmacy to charge, requiring the pharmacy to collect, or in 3, requiring a covered person to make a cost-sharing payment to a covered prescription asthma inhaler amount that exceeds such limitation. The provision applies with respect to these health plans and contracts entered into, not renewed on or after January 1st, 2022. Thank you, Mr. Chair.
Okay, so the thrust of the bill is essentially capping this at $50 a month?
Yes, Mr. Chair.
Okay.
Just working on trying to get prescription drug costs down.
Mr. Chairman?
Senator Bell.
Mr. Chairman, a question for the patron.
Go ahead.
My question on this is, I know last year I think we did this with insulin, and there was frankly some concerns that that might be the beginning of a Christmas tree effect. And now I'm wondering, frankly, what's after this bill. While I don't want to see prescription prices be too much, I also don't want to have people not get the right medicines that they might need, and I'm worried that this could affect prescriptions. I'm seeing the average medicine in this range is anywhere from $300 to $500 per month. Can you speak to that and tell me about the pricing and how this would affect insurance costs? Thank you, Mr. Chairman.
Mr. Chair.
Delegate Askew.
I agree with the senator. This would potentially, or to his point about Christian effect, and I've spoken with the folks that are considering this, and we're looking to do some hurt things in the future. So we work with transparency and work a wholesale cost instead of looking each year to add additional medication.
Mr. Chairman, could I follow up?
Senator Bell.
Respectfully, I didn't really hear my question answered. Is this going to cause insurance to go up?
Well, Mr. Chair, speaking to the senator, this is not expected to have a fiscal impact to the state corporation commission. So it would potentially, but not for another few years. And like I said, we're working on some wholesale changes to help prescription drug costs.
Delegate Askew, we have to ultimately vote on this, but you ought to be able to read, between the lines. Probably this is going to be the last of the bills that will get through the Senate dealing with pharmacy prescriptions this way. Okay,
Mr. Chairman?
Senator Spruill.
You might be reading the T's long, because the key what he was speaking about is this: there is no guarantee, but what he is trying to do for certain types of prescription, there is no guarantee that everything will go up. So I think the senator bill is making the assumption that because what he's doing here, that will up the price on everything. That is not. So I'm hoping that we can put this bill out.
If they got to cap that or have the insurance company subsidize it, it's going to raise rates.
Mr. Chairman.
Senator Newman.
Mr. Chairman, one thing's for sure is that for most people, this bill will have no impact because most people are under an ERISA plan. The only people this is going to hurt is small business. Make no mistake about it. It's just the small business. You can't get to Walmart. You can't get to Sam's. You can't get to anybody else. These bills go after small business only and raises their rates. It does not raise the rates for others. We can't reach ERISA unless we have federal action. So that's my concern, is it feels good, but it feels good because no big company's in here lobbying against us today because it's only the small business that'll be affected.
Well, Mr. Chairman, if you're ready for a motion, I move the report.
Mr. Chairman.
Mr. Stevens. Oh.
Mr. Chairman.
Senator Mason.
So I just want to piggyback on what Senator Bell said. You know, last year we had insulin come in here, and we were talking about it, and there was a number, and somebody from the dais said, well, yeah, what about $50? Yeah, $50. And we amended it and made it $50. That was an incredibly data-driven decision we made there. So I voted no, at which point somebody on the street thought that maybe you passed me by saying, can't believe that I want to keep insulin from poor people that need it. And that's not the case at all. I suffered from a bit of asthma, not bad, growing up, and nothing worse than not being able to breathe. But, you know, the very next year, we come back, and it was insulin last year, it's asthma, and it seems like it's any product that deals with asthma, and it's our $50 number again. And so I think the delegates, you know, has a very well-intentioned bill, but, you know, here we go immediately, and this is probably not the way to make prescription drug policy. Here in the General Assembly, in the Commerce and Labor Committee, picking things that are very difficult to live with, and we want to make sure everyone has their asthma medications. But
there's two people in line to speak.
That's enough.
Okay, you each have about 30 seconds, so as to whether you support or oppose. Go ahead.
Jeff Palmore, please go ahead.
Maybe let Doug Gray go first. And then I'll...
Jeff Palmore, go ahead. I couldn't hear you.
Mr. Chairman, it's Doug Gray from the Virginia Association of Health Plans. Jeff asked if I could go first. I'm representing the health plans, and we're concerned about this approach. The language is written very poorly. It brings in a whole lot of, it basically applies to any drug. And this definition change that was just made switches to the definition of a health benefit plan under 38.2, 3438, which includes the words arrange for, pay for, reimburse any of the healthcare costs of healthcare services. So it appears to be trying to reach to the self-insured, which I'm not sure is permitted by federal law either. Okay. So anyway, we have the same concerns that have been mentioned. I mean, this is the Christmas tree. We warned you last year when you did insulin, and it keeps coming each year.
Thank you. Thank you, Doug. Jeff?
Yeah, Mr. Chairman, Jeff Palmore here on behalf of America's Health Insurance Plans, AHIP, and we agree with Mr. Gray. I think the right way to deal with this is to send this to the HERC for them to evaluate the true cost of this bill on consumers before we pass it on to them. Thank you.
There are no other speakers, Mr. Chairman.
All right.
Chairman?
Bills?
You heard...
For Senator Sproul.
You heard two, Doug and Mr. Palmer, who've spoken. Well, you know they're going to speak against because they work for the, well, we like to say the man, but insurance company, so surely they're going to speak against it. You've heard that Senator Newman has said that it will hurt small business, but it won't hurt the regular person. We're looking out for the regular person. We're not trying to look out for the big business. We're not trying to look out for the insurance company. This is a good bill, and it help the regular person on the street. So with that, Mr. Chairman, I move that we report this bill.
Mr. Chairman.
There's Senator Obenshain.
Yeah, let me just point out that while these folks may work for large insurance companies, they're not the one, they really honestly don't care that much, except to the extent they represent us. It's us, the people who are paying the premiums, who are going to pick up the tab for this. Don't think for a second that we're just sticking it to the insurance companies, because we're not. They pass along every penny of that expense.
Mr. Chair.
Go ahead, Delegate.
Mr. Chair, while I hear the senator's concerns, I echo Senator Sproul's, what he said. This is about the small person. It's about, mom and pop making sure their kids could breathe. There are situations. I had a situation in my district where somebody couldn't afford, their butyral inhaler. Like their child almost died, was in the emergency room. We're just looking out for the middleman. Now I challenge the senators let's pick up this cost. Like folks aren't able to, get insulin as delegate last year. And as we say, might potentially be a Christmas tree. I challenge you all to continue to work on this cost. We can't continue to do this.
All right, bills before us. Is there a motion? All right, there's a motion and a second. Those in favor of reporting the bill, vote aye. Those opposed, no.
Ayes 5, noes 10.
All right, ayes 5, noes 10. The bill fails to report.
Mr. Chairman, Surville.
Senator Surville.
Mr. Chairman, that bill to me smells an awful lot like something that the Health Insurance Reform Commission ought to be looking at, because that's exactly what the HERC is designed to do, is to vet benefits. And it seems to me that, Mr. Chairman, you could send a letter to the HERC and ask them to look at it.
I will do just that.
Thank you.
Can you draft up that letter to go to HERC? Okay.
Mr. Chairman, do you need a PBI to do the letter, or can you just, no, you can just do it? Yeah, because if we could include in that letter, one of the things I think we need to know is, as Senator Mason said, the $50, where did that come from? What is the right amount to cap these at?
Tom, can you look into that and see if we can't come up with a number that might, go down a whole lot better? All right. Okay, so the letter will go. The letter will go. Okay. All right. Next, let's see. Insurance. We just finished. Ask you. Next is Delegate Head, House Bill 1829.
Thank you, Mr. Chairman. This is a bill that came to me from the State Corporation Commission. It's a cleanup from last year's bill on credentialing. We had inadvertently left out making sure that health credentialing for insurance plans applied also to HMOs and to vision and dental plans. And the SEC thought that would be something we wanted to include, and they brought me the bill, and that is what's before you. Very simple measure.
Okay. You heard the explanation for the bill. Is there a motion?
Move to report.
All right. There's a motion and a second to report House Bill 1829 dealing with credentialing of healthcare providers. All those in favor, vote aye. All right.
Ayes 15, no 0.
All right. Next is House Bill 1892. That's Delegate Ayala.
Hi, Mr. Chairman.
Oh, hi, Delegate Ayala. How are you?
I'm fine. How are you?
Okay.
I will make this real quick. This is a bill introduced on behalf of the SEC. And essentially, what is happening with this bill is that the insurance code section which applies these types of policies require a 30-day waiting period after a form is filed before an insurer could use it. So this bill would just remove that requirement. That requirement meaning 30-day waiting period, so that there's consistency and approval for all lines of insurance subject to all forms. So with that, I will turn it over to you, Mr. Chairman.
Okay, are there any questions of Delegate Ayala? All right, you've heard the bill. It's pretty simple. It just permits the insurance to receive approval of the policy form or an endorsement from the SEC without having to wait 30 days.
Mr. Chairman, move to report.
All right, motion and a second to report House Bill 1892. All those in favor, vote aye.
Ayes 15, no 0.
Okay, bill is reported 15-0.
Thank you, Mr. Chairman and members of the subcommittee.
You're
Bye.
welcome. All right, next is House Bill 1942. That's Delegate Kilgore.
Thank you. Thank you, Mr. Chairman. Thank you, Mr. Chairman. This bill is also a State Corporation Commission bill. It deals with public adjusters and their continuing education requirements. And the continuing education requirements for other agents are administered by the Insurance Continuing Education Board. And when the public adjuster law was enacted, the Bureau of Insurance was required to administer this continuing education. We're simply moving it from the Bureau of Insurance over to the Insurance Continuing Education Board, and that's all it does, Mr. Chairman.
Okay. You've heard the explanation. Any questions of Delegate Kilgore?
There are no hands raised, Mr. Chairman.
Okay. All right. There's a motion and a second to report House Bill 1942. All those in favor, vote aye.
Ayes 15, no zero.
Okay. Next is 2219. That is Delegate Hodges' bill. Is he there?
I am here, Mr. Chairman. Good afternoon.
Good afternoon. There you are.
I'm here.
Okay. You want to explain the bill and why we need it?
Sure. Thank you, Mr. Chairman, members of the committee. I'm bringing to you House Bill 2219 to ensure patient freedom of choice for pharmacy services. Virginia presently has a fairly narrow freedom of choice statute. This bill clarifies that not only for retail pharmacies, but also for specialty pharmacies, that the carriers and PBMs must allow a pharmacy to obtain a contract if the pharmacy meets the terms and conditions. And it's important to note that the PBM or the carrier is the one that sets these terms and conditions. Presently, we have observed pharmacies spending up to $50,000 or more to obtain a required certification for specialty services, only to be informed that the PBM or the carrier will not offer those pharmacies a contract. The bill also requires the carriers or the PBMs to respond to a request for a contract within 60 days. Even for retail pharmacies, we are observing delays as long as 11 months for a health plan carrier or PBM to respond to a contract request after completing credentialing and spending upwards of $50,000. So that's the bill in a nutshell, Mr. Chairman.
So essentially, it's a freedom of choice. All right.
Yes, sir.
Any questions of Delegate Hodge?
Yeah, Mr. Chairman, Senator Eben here.
Senator Eben.
Yeah, I should probably know this, but what are specialty pharmaceutical benefits as opposed to regular?
Specialty drugs, initially when specialty drugs entered the market, they were the more expensive medications that required either special education to the patient or even special storage requirements. And over time, that's evolved into each PBM establishing its own specialty drug list. Typically, you think of the expense of the Humiras or the Enbrels, but other things such as HIV medications, and we've even seen an older drug, oral methotrexate, that has been around for years and fairly inexpensive, move over into the specialty list for particular PBMs.
Thank you.
Mr. Chairman,
Senator Edwards.
My experience is this is long overdue. Thank you. Delegate Hodges.
Thank you, Senator Edwards.
All right. You've heard the bill. You've heard the explanations.
Mr. Chairman.
Need for the
Mr.
bill.
Chairman.
Hold on, Senator Spruill.
I move that the bill be reported.
Second.
All right. Are they in opposition?
No, Mr. Chairman, this bill's okay.
Okay. Good to go. All right. There's a motion and a second. Motion and a second to report House Bill 2219, freedom of choice of pharmaceutical coverage. All those in favor, vote aye. Aye. And the motion is to report and refer to finance.
Is it?
Ayes 15, no zero.
All right. All right. The last of the insurance bills is House Bill 2332. That's Delegate Sickles.
Good afternoon, Mr. Chairman, members of the committee.
Hi, Mark. How you doing?
That calling? Did you call on me?
Yes.
I'm doing well, Mr. 2332 is a reinsurance bill. The intention of the bill is to lower healthcare premiums in the individual market. Reinsurance allows you to do that by allowing the insurers to when a patient reaches a certain point in their care to apply for a reimbursement from a reinsurance fund. It lowers the premiums for everyone else and reduces the risk for insurers in the individual market. Virginia has fairly high individual market rates. It's over $600 a month on average for citizens, and there's a lot of people interested in this bill. I'm not sure if you're taking testimony, but since this bill did not go to subcommittee, but the Virginia Realtors, AARP, the Virginia Poverty Law Center, the Commonwealth Institute, the Virginia Hospital and Healthcare Association, Small Business Majority, Medical Society of Virginia, Heart Association, Leukemia Lymphoma Society, Cancer Society, Breast Cancer Foundation, Hemophilia Foundation, National MS Society, and National Lung Association all support a measure to do this. And I know that there is difference of opinion on how to fund it, but Mr. Chairman, there is a technical amendment to this bill. If you want to keep going, that is from the Bureau of Insurance that Mr. Stevens could present to you. This is non-controversial technical amendments.
Okay, Tom, go ahead.
Mr. Chairman, the substitute should be available online.
All right, so we need to adopt the substitute. All right, it's been moved and seconded that we adopt the substitute. All those in favor say aye.
Aye.
All right. My understanding is there are a fair amount of people to testify on this bill. First, before we do that,
Mr. Chairman?
Are there any questions of Delegate Sickles? Senator Barker.
Yes, Mr. Chairman, I have an amendment to the substitute to put this in a position where we can consider a different approach in terms of the financing of this benefit, which I think is very good. I'll call on Mr. Stevens to present that, and then I'll present the rationale for the amendment.
Okay. Mr. Chairman, Senator Barker, I believe Senator Barker's amendment to the substitute would remove Section 38.2-6605, which is the assessment on the plans. It would also remove any reference to that assessment and renumber the bills, as well as add an enactment clause that says the General Assembly shall appropriate a sum sufficient to ensure the operation of the Commonwealth Health Reinsurance Program.
All right, I'll offer that and to basically just provide the rationale for that. I think it makes much more sense for us to provide the funding for it from general fund resources than to impose a tax that goes for some health plans but not for many other health plans. And so it's only a minority of health plans that are out there that would be challenged with this tax that would be imposed, and it would certainly be passed on to the people who have those health plans. I've worked with Delegate Sickles on this. He's certainly well aware of this. He is neither endorsing nor opposing this amendment. Wants to move the issue forward and be able to resolve the issue, the how of the financing of it. What it would do is it would make sure that we would not be enacting a tax increase on anybody as a result of this bill. We would not be setting up, in essence, benefits that would be going in three different directions. If you have the tax that's on a certain number of plans, but only about a third of all plans in Virginia, if that would be covered by that tax increase, which would be passed on to those individuals and businesses. Right now, what it would do, it would mean that some people would get a reduction in what it would cost for their health insurance. 2/3 of the people who have health insurance would not have any effect, and 1/3 would get a significant increase in their health insurance cost. I would also point out that under this provision, if we go forward with it, we would receive substantial federal monies with this reinsurance proposal that Delegate Sickles has.
Can you explain how, so everybody would know?
Yeah, the way it works is that we would have to go to get a 1332 waiver, which is in Delegate Sickles' bill, that would from the feds, from the Department of Health and Human Services, to get that plan approved. This is now in place, and I think it's 14 or 15 states. And right now, the way this process is set up, we should be able to get the approval pretty quickly. because the federal government will be saving a substantial amount of money as a result of the lower premiums that would be introduced by this, they provide a lot of the benefits through tax policy to the individuals who are paying these, who are enrolling in the health care exchange. And we would actually get about $5 for every dollar we would invest.
How is that?
Because we get a reduction, we would pay the amount for the for a 10, 15, 20% reduction in premiums, because the premiums are much higher, a good bit of their cost is because you have a lot of lower income people who get tax benefits as a result of this, and that those are covered by the federal government, and they would pass those on to us. So it's basically we would get that 5-to-1 benefit as a result of moving forward. So. It's a tremendous benefit to the Commonwealth to get this. It's going to benefit a lot of people. This way, we're not setting up a tax increase, and we're not trying to have some people premiums go up, others stay the same, and some go down. That we would be actually helping everybody. Nobody would suffer as a result of this. And so I would hope that we would adopt this approach on things. And we've had discussions already with the chair of Senate Finance and Appropriations on this, and I think that obviously it will be appropriate to then refer this on to Finance and Appropriations.
Mr. Chairman.
Right. Well, you've heard Senator Barker's amendment. We need to adopt it or not.
Mr. Chairman. Surville.
Senator Surville.
Thank you. Speaking in favor of the amendment, Mr. Chairman, the way the bill is written right now without Senator Barker's amendment, it really focuses the cost of this upon smaller businesses that have to buy their insurance plans from insurance companies, as opposed right now nobody who has Medicare, Medicaid, or is in a large company with a self or who isn't self-insured has to pay for this. And so from my perspective, this is an excellent idea, because to me this is a cost that ought to sort of be socialized across all Virginians instead of just isolated on one small segment of business. And so I think it's a good idea.
Okay. Is there a motion to adopt the amendment? All right. All those in favor, say aye.
Aye.
Opposed? All right. The amendment's adopted. How many people do you show wanting to speak?
We have 9 speakers, Mr. Chairman.
We can't. All right. Each of you will have 30 seconds to state whether you're in favor and why, or whether you're opposed and why. Let's see those in favor first. And each side only has a total of 3 minutes, so actually you might want to make it less than 30 seconds. Go ahead.
If those who have been moved into the panel could please raise their hands if they are for the bill to be called on. Chelsea Bennett, please go ahead.
Yes, good afternoon, Chairman and committee. Thank you for the opportunity to speak. Chelsea Bennett on behalf of the American Heart Association, as well as the Healthy Market Virginia Coalition. You heard over 20 organizations listed. We support reinsurance, and we ask for your support on this bill.
Hey, thank you so much.
Sarah Carino.
Cariano, thank you. Good afternoon, Chairman and members of the committee. Sarah Cariano with the Virginia Poverty Law Center. Also members of the Healthy Market Virginia Coalition, and we also support this bill. We did support the health insurance assessment. Simply, it is significantly lower than a federal assessment that recently expired, and on fewer plans, because you can fund this program with the assessment on fewer plans.
Okay.
And the federal assessment was on assessments that the state cannot place an assessment.
You would support the bill, right? Okay. Next.
Aaron Barton.
Aaron?
Good afternoon, Mr. Chair, and the committee. Aaron Barton with Virginia Realtors, and we do support this bill.
Thank you so much. All right.
Thank you.
Next.
Doug Gray, welcome back.
Mr. Chairman, on behalf of the health plans, we support the bill.
Thank you, Doug.
Julie Dime.
Good afternoon, Mr. Chairman, members of the committee. Julie Dime with the Virginia Hospital and Healthcare Association. We support the bill.
Thank you, Julie. Next.
If anyone else is in support of the bill, please raise your hand. Natalie Snyder.
Good afternoon, Chairman and members of the committee. I'm Natalie Snyder with AARP Virginia, and we support the bill.
Thank you. Next.
Becky Bowers Lanier.
Good afternoon, Mr. Chairman, members of the committee. I'm with Virginia Breast Cancer Foundation, the Healthy Market Coalition, and the Hemophilia Association of the Capital Area, and the Virginia Hemophilia Foundation. We support the bill.
Okay, those opposed, wave your hand. All right, there appears to be no opposition.
If you could raise your hand digitally in Zoom, please, if you are opposing the bill. I see no hands raised, Mr. Chairman.
All right, thank you all. The bill is now before us.
Move to report as and refer as amended.
All right, there's a motion and a second to report and refer to finance. All those in favor, vote aye. All right. The bill is reported.
Ayes 12, noes 2.
Okay. All right, that finishes the insurance bill. Believe it or not, we're down to 4 bills, 2 workman's comp bills and 2 unemployment comp bills. All right, let's go, and all 4 have to go to finance. All right, workers' comp bill 1754, Delegate Carter's bill. Delegate Carter, are you there?
Yes, Mr. Chairman, thank you so much. House Bill 1754 addresses a problem that is very commonly occurred by working people within this Commonwealth. So commonly, in fact, that in the building trades, there's a joke for it, which is when you fall off a ladder, you are fired before you hit the ground. This bill expands protections that were passed last year for people testifying in wage theft cases, expands those anti-retaliation protections to people that are filing or testifying in workers' compensation cases. Under current law, the only prohibited retaliatory action is an employer cannot fire the employee solely for the purpose of retaliation, which means that under current law, they are allowed to fire the worker for retaliation and those and reasons are often quite minor. For example, being 30 seconds late. They are also allowed under current law to take retaliatory actions short of dismissal. Perfect example being actually what happened to me when I was injured in 2015. I was moved from full-time status to part-time status. My health insurance was canceled and I was scheduled for 0 hours a week. If the Senate were to pass this bill and it becomes law, then any retaliatory action against an employee on the basis of retaliation would be prohibited. So I hope it will be the pleasure of the committee to report the bill to the floor.
Mr. Chairman.
Any questions of Delegate Carter?
Mr. Chairman. Surville.
Senator Surville.
Thank you, Mr. Chairman. So I'm very familiar with this statute that we just passed, I believe, last session. Mm-hmm. What I'm trying to understand, because I think this statute created a cause of action for retaliation, what the purpose is of the language on line 13 is, why we need to add or person. I don't understand how that relates to the purpose of the bill. Right now it says no employer shall do all this stuff. Well, why are we creating a cause of action against a person who's not an employer?
Mr. Chairman, Senator Surville, I would say I don't believe that the word person there is intended to be a substantive change. I believe that is an update to the language of the code to keep it in compliance with sort of the current drafting guidelines, but I don't believe that language is intended to be substantive. However, if for the comfort of this committee, you would like to remove the words or person, I would not be opposed to that.
Mr. Chairman.
It's actually in line 42 as well.
I see that, Mr. Chairman. I have a question for counsel.
Mr. Chairman, Senator Surville, I believe it was just to mirror the language on line 42 and on line 13.
Mr. Chairman.
Mr. Chairman.
Senator Surville.
Thank you. But my question to counsel is, I appreciate the fact we're making this retaliatory action statute consistent with, I guess, language in the Workers' Compensation Act, but they're two different acts. And I'm assuming, Mr. Stevens, you're the one that drafted it. I was just curious if you, besides making them consistent, why we think we need to make these two acts consistent legally.
Mr. Chairman, Senator Surville, I don't recall, but certainly reading it now, removing or person would not substantively change the bill.
Okay, Mr. Chairman, then I would so move.
All right. You've heard a motion and a second.
What is the motion again?
I think it's remove the word person on line 13. All right. All those in favor say aye.
Aye.
Opposed? All right.
Mr. Chairman.
Senator Edwards.
I have several questions. On line 6, I guess it's line 26, says 6 has filed or intended to file, and later or has testified or is about to testify. I mean, that's not very clear. The intending part, I don't know how they can prove that, but I think it'd be better to leave it has filed or has testified and delete those other lines. And the other part has to do with under section 65-2 through 8 under 41, consistent with federal law. If the bad acts that cause discharge is a factor, not rather than is motivated by knowledge or belief, that needs to be cleaned up. That's the whole line between 41 and, I don't know, 45, I guess it is, or 44. That needs to be cleaned up to make it clear that this is a factor in the discharge, kind of like EEOC laws. So my recommendation is we clean these up, and council, ask council to do that.
Mr. Chairman.
Here for council, line 26, delete or intends to file, delete or is about to testify.
Mr. Chairman. Mr. Chairman, I had some concerns about the same area about intends to file. How's an employer supposed to know that an employee intends to file if they don't tell them that? I mean, basically, if there's a for-cause reason that an employee would be fired, they could just say, I intended to file, and now they've got coverage. That doesn't seem to be fair for the employer. I don't know if the patron or council could speak to that, but I'm concerned about that intends to file.
Mr. Stevens.
Mr. Chairman, Senator Bill, I would defer to the patron for the intends to file question.
Mr. Chairman, if I could.
Senator Newman.
I want to agree with Senator Bell and maybe go one step further. I mean, you have to, with the language that's here, derive the knowledge or belief of the owner or the manager. You've got to figure that out. Number two, if you get rid of them, really for any reason, and they had it in their mind to file, now they're going to have a case of action against the employer. This is actually, in my opinion, going to turn everything on its head, and everything that you do is going to be held that it was done for the purposes because you were intending to do something that was retaliatory. Mr. Chairman, I just don't think that's the way that we should put things into this business section of the code.
All right, is there a motion then to remove intends to file?
I've made the motion on line 26.
All right.
Delete.
Is there a second?
Or intends to file and delete or is about to testify.
Mr. Chairman, could I just have a substitute motion to PBI? I think this needs a lot of work, and so I'd like to have a substitute motion to PBI. It just, I know where he's trying to get to. I just don't think you can get there with any of these words.
Well,
I'm
trying to fix it.
You've heard the motion. Is there a second?
Mr. Chairman, is there any public comment on this, just out of fairness?
Yes, Mr. Chairman, we have a couple of hands raised.
Okay. Can you hold on your motion? All right, go ahead. How many people?
We have 3 people in the queue, starting with Joe Hudgens.
All right, take no more than 30 seconds.
Joe Hudgens with the Independent Insurance Agents of Virginia. Our members are small business. This would put an incredible burden, and we would be thrilled with the PBI.
All right, thank you. Next.
Jay Deck, please unmute and go ahead.
Jay Deck with the Virginia Education Association, and we support the bill.
All right, thank you. Next.
John Hurd, please go ahead.
Chair John Hurd on behalf of the Virginia Self-Insurance Association and Metis Holdings. We've opposed similar versions of this bill the last 3 years, I believe, over in the House. It's still got the same problems. Y'all have already hit on it. Let me call the committee's attention down to line 44. Bill's language, and I quote, "If such action is motivated by knowledge or belief." That's a very low bar. It's going to allow suits to be filed against employers when the employee thinks the employer believes that the employee intends to file a workers' comp claim. It's just incredibly subjective. The bill needs a ton of work, and we oppose it.
Mr. Chairman.
Senator Marston.
Thank you, Mr. Chairman. When I ran a juvenile detention center, we had a policy on being tardy, and you were allowed up to a certain number of tardies in a given period of time. If somebody hit their time clock and knew they had just hit the danger zone where they were going to be disciplined, they could immediately begin thinking about or begin filing a grievance against the policy or whatever, and you would have a situation where people would be acting in advance of any discipline they knew was coming, and I just think it does, like Senator Newman. I think this needs a lot of work.
All right, there's a motion to PBI. Is there a second? All right, there's a motion and a second to PBI. All those in favor of PBI, vote aye.
Ayes 10, noes 5.
All right, 10-5, it's PBI'd. All right, actually, by the way, there were 5 bills left, not 4. So there are now 4 bills left. The next is House Bill 1985, Delegate Hurst.
Thank you, Mr. Chairman, members of the committee. House Bill 1985 is a familiar subject to you and to your chamber. You dealt with this and had to go over to Senate Finance when presumption of compensability for COVID-19 was kind of incorporating healthcare workers and all of the kind of local government employees that are now in Delegate Jones's bill. This bill strictly focuses on healthcare workers, and it's fairly simple, Mr. Chairman. It says that there's a presumption that COVID-19 causing death or disability for healthcare providers is an occupational disease compensable under workers' comp. It says, though, that those healthcare workers have to have worked directly with COVID-19 patients in their regular course of duty. I do believe, though, that council has a technical amendment.
Mr. Stevens.
Thank you, Mr. Chairman. Delegate Hurst, the amendment should be available online shortly. It is line 78 after unless, insert the person is immunized or.
Okay.
I move the amendment.
All right, there's a motion second to adopt the amendment. All those in favor say aye. Aye. All right, the bill would have to go to finance if it gets out.
Move to report and refer.
All right, motion to report and refer.
Mr. Chairman?
Yes.
We have a few members of the public with their hands raised.
All right.
Mr. Chairman, before we do that.
Senator Newman.
Is this one retroactive?
It says March 20th. Here.
So, Mr. Chairman, does it line up with the dates in your bill?
No, mine is July 1st. Let's amend this to make this July 1st.
Mr. Chairman, I move that
All right, is there a second?
Second.
All right, there's a motion and second to turn March 12th, 2020 into July 1st. All those in favor say aye. Aye. All right, it's the amendment's adopted. All right, how many in the public?
Mr. Chairman, there are just 2 speakers.
Okay, you each have 30 seconds. Tell us whether you support it or you don't.
Mary Goldschmidt.
Good afternoon, Mr. Chairman. I wish we had more than a second to tell. We support 1985 wholeheartedly. We respectfully would like to have the retroactive date to March 2020.
Well, we just changed that.
I know. But I did want you all to know that nurses are the #1 group of healthcare professionals who are impacted by COVID, and the #1 group, the largest numbers who die from COVID. I represent the Virginia Nurses Association. We're 110,000 strong, 110,000 plus. And this is incredibly important to our membership. Thank you.
Thank you so much. Next.
Holly Zimmerman.
Welcome, Ms. Zimmerman.
Holly, please unmute and go ahead.
All right, looks like she's not unmuting. All right, that's it then. All right. All right, the bill's before us.
Move to report and refer as amended.
All right, the motion is to report and refer Delegate Hurst Bill 1985 as amended to Senate Finance. All those in favor vote aye. Opposed, nay.
Ayes 15, no zero.
Okay, bill is reported and referred to Finance. All right, now we get into unemployment compensation bills. The first bill is HB 2036. That is Delegate Trans. Delegate Tran, you there?
I'm here, Senator. Good evening.
Okay.
Good afternoon.
Welcome.
Thank you. So HB 2036 allows the Virginia Employment Commission to use electronic means, whether that's email, text messages, or online portal, to communicate with both the individual claimant as well as employers. And so a person or the employer can choose either an electronic method or it can choose to continue to get their correspondence via snail mail. So currently, the VAC is required to provide certain notices by snail mail. And as we all know, there was about 1.4 million Virginians who filed for unemployment this year. And when an individual files a claim, they receive 3 different types of letters in the mail, and the employer receives a form in the mail. And so if you do the math, this adds up to millions of correspondence by snail mail. And so sometimes it gets clogged up in the system, it's a little bit slower and makes it hard for people to make the deadlines. And so this opportunity, this bill would give individual claimants as well as employers an opportunity for a more quick and efficient system to get information. It would also possibly save the state several $1 million in postage. Just since the start of the pandemic, the VEC has spent about $2.8 million in postage alone.
Okay, you've heard Delegate Tran. Are there any questions of Delegate Tran? This was unanimously reported out of the House.
Move to report.
We have one.
Well, one person to speak. Okay, go ahead.
Nicole Riley, please unmute and go ahead.
Ms. Riley?
Yes. Hi, Senator Saslaw and members of the committee.
Welcome.
Nicole Riley with NFIB. And very quickly, we support the bill. Thank you.
Okay. All right.
Move to report.
All right, there's a motion and a second to report HB 2036. All those in favor vote aye. Okay. Delegate Tran, it bills.
Somebody has his proxy.
All right. Bill is reported.
Ayes 15, no zero.
15 to 0. Delegate Tran, you have 2037.
Yes, sir. So this bill deals with who remains eligible to receive unemployment insurance once they get a return to work notice. So the U.S. Department of Labor has actually given states a lot of flexibility to make sure that our regular unemployment insurance programs are able to respond to COVID. And this bill would expand the reasons that individuals are able to stay on UI through their current eligibility, the number of weeks that they're eligible for, if they have a return to work order in 3 instances. One is if they've been diagnosed with COVID or experiencing COVID symptoms and are getting a medical diagnosis. The second is that they're providing care for an immediate family member or somebody in their household. And then the third reason is if they have a reasonable belief and provides evidence that their workplace is not in compliance with the standards that have been set by the state or by the U.S. government. These are reasons that are actually a part of the PUA program. And we know that Congress is kind of incrementally expanding PUA, the Pandemic Unemployment Assistance Program. And so rather than make people switch out of regular UI and apply for PUA, it gives some continuity of benefits during that time. And I think there are many states that have taken advantage of this flexibility already. There's states all across the country, red and blue, in the Pacific Northwest and the Northeast and the South. And so they include Minnesota, Michigan, Colorado, North Carolina, Connecticut, Washington State, Texas, Ohio, and Vermont. I do have a line amendment that I would need to move, and I could explain that at the proper time as well.
Now would probably be the proper time.
Thank you, Mr. Chair. So council has that line amendment, and this was brought to me by the Manufacturers Association, just to clarify that if you have a reasonable belief and provide evidence that your workplace is not in compliance with the workplace standards around COVID, that it's to your particular workplace, because we know that different industries are regulated and have different procedures that they have to adhere to. And so I think council has that.
I have a question for you.
Yes, sir.
You say that they could draw unemployment if they had to take care of somebody in the family. And what's the difference between that, other than who pays, what's the difference between that and paid family leave? Other than the difference of who pays.
Yes, I mean, sometimes some employers also offer paid family leave, but this would come through the unemployment insurance program. It's that they are currently unemployed in that moment. And so they may not be eligible, right, for paid family leave through their employer if they are not working.
But taking care of a family member is quitting a job to take care of a family member is not, at least to my knowledge, been allowable to collect unemployment.
You're right, sir, that is currently not the policies in place for the regular unemployment insurance program. But because of COVID and the nature of this pandemic, the U.S. Department of Labor has actually made that an exception to the Pandemic Unemployment Assistance Program. So if we put it to our regular program, similar to the other states I noted, it gives, it's not, a new pathway that we are inventing. It's actually something that's approved by the U.S. Department of Labor.
Senator Newman?
Well, Mr. Chairman, and following on to your request, but it appears the way it's written that if they've ever tested positive for COVID and they've recovered, they qualify. In other words, if they're done, come back, they qualify. Number two, if the individual has reasonable belief or evidence that the workplace is unsafe because they don't meet. So if they believe reasonably that it's unsafe, you just don't come. I mean, that's what this does. So, Mr. Chairman, I don't know how to fix it. So, Mr. Chairman, I would hope that we would not do it.
Mr. Chair, if I could respond to those two concerns. So just on the second part about if you have a reasonable belief that your workplace is not safe, on line 153, it says based on satisfactory evidence, which actually means you have to provide evidence to VEC. And we did have discussions with VEC as to what that might mean. And so that could be testimony, that could be documentation of some sort. So it's not that you could just wake up one day and decide that your workplace isn't safe. I think the vast majority of people who are on unemployment insurance want to go back to work because the levels of that they're receiving on unemployment right now probably are far less than what they would receive if they were able to work and draw their paycheck. And so we know that people are in a really tough position right now because they are making these decisions to go back. And it's, and I think we could ask council to clarify the first on if you have, you're right. I think, Senator, that we could clarify the language that if you're like tested positive, kind of, you're still in that quarantine period, which was our intention to remain at home, but we don't want people who are sick to go to work.
Senator Obenshain has a question.
And maybe this puts a finer point on what Senator Newman was asking, but as I read Section 4 on lines 147 through 152, if you have ever tested positive for COVID, you never have to return to work under this bill. Is that correct?
That would be correct.
Sir, you're right.
Or if you have ever been directed by a physician to quarantine, you never have to return to work. Or if you have a family member who you ever cared for who had COVID, you never have to return to work.
Mr. Chair, I would respond to the senator by saying I would, that was not our intention. And I would accept as a friendly amendment to qualify that and say kind of like in that period, while you received your letter, if you are in that quarantine mode or you have a positive test, within like that day or that week and you need to quarantine or you're caring for a family member who currently has it, I would take that as a friendly amendment. If that would help clarify your concern, sir.
I move the friendly amendment. I guess staff can come up with that.
I second that, Mr. Chairman.
Mr. Chairman,
Senator Newman.
I respect the fact that there's an
Chairman, we got a
amendment.
motion on the floor.
All right, is there a
Need the
motion to
motion.
adopt the amendment?
So you can do the motion, Mr. Chairman.
All right.
I don't know what the motion quite is, but I will say, I think you have to fix all of it. In other words, you have to fix everything in 4 and everything in 5. And if that's the motion, then it's a much different bill. Mr. Chairman, I know I may not get it, but it just seems to me that we should not do this. People should return to work after they've tested positive for COVID and they've gotten better. After they've been told by a physician that they're okay to not quarantine anymore, they ought to return to work. And we ought not let an individual determine for themselves with their own satisfactory evidence that it's not safe. And, Mr. Chairman, as a result of that, I would make a substitute motion that the bill be PBI'd.
All right, substitute motion, PBI. All right, all those in favor of PBI, vote aye. Those opposed, vote nay.
Ayes 9, noes 6.
All right, the bill is passed by indefinitely. Thank you, Delegate Tran. 1 out of 2 is not bad. All right. That was 2037. All right, the last bill is 2040, which also would have to go to Finance, and that is Delegate Hudson. Delegate Hudson, you're up.
Thank you, Mr. Chairman and members of the committee. House Bill 2040 addresses 2 of the major challenges that Virginia workers faced with unemployment compensation this year. I know that unemployment claims were the #1 reason that constituents contacted me last year, and I know that many members of this body can say the same. The bill does 2 main things. It codifies the governor's directive from December that a claimant who is granted benefits can't have those benefits cut off until they're afforded due process in a
Mr. Chairman, and I apologize for interrupting, but to this point, can I ask the delegate a question?
Go ahead.
So would this would this require the state to continue paying unemployment benefits to the prison inmates who are getting $40 million?
Mr. Chairman, excuse me, I'm sorry, I didn't see who asked the question.
It's Senator Obenshain.
Mr. Chairman, Senator Obenshain. There is a separate provision of the bill which deals with fraud, which ensures that any payments that are given to claimants who committed fraud would still be stopped and collected. So that's a separate provision of the bill, which would leave untouched state code.
Mr. Chairman, Surville.
Senator Surville.
I believe the patron has a substitute, which I think we probably ought to get before us so everybody can see it as she's presenting. Is that right?
Mr. Chairman, that's correct. If now would be an appropriate time to move the substitute, that would be just fine.
Mr. Chairman, I'd move the sub.
Second.
Motion is second to adopt the substitute. All those in favor, say aye. All right, substitutes before us.
If I can briefly explain the substitute, we had some quick amendments that came out of House Appropriations, and VEC and I have worked together in the time since to clarify some of that language. We also reversed a provision that was in the House bill that addressed timely response by employers. By restoring that provision to its existing status in state code, the Chamber of Commerce no longer objects to the bill and has no formal position on the bill. So we addressed their concern.
Mr. Chairman.
Senator Newman.
So just to be clear what substitute is, because I don't see it logging up. So you restored the portion related to the time it takes to respond, is that correct? So it's only related to overpayment?
Mr. Chair, Senator Newman, yes, we did restore all of the provisions related to timely response. So the only 2 big changes in the bill relative to current state code are about continuation of benefits, which is the first point I was explaining, and then the second piece, which you just described, which was overpayment waivers.
Well, Mr. Chairman,
Senator Newman.
Mr. Chairman, I hope the VEC is on board to talk about this, because basically, if you, in any portion of government, under the tax code, even under the TANF law, whatever it is, if there's an accidental overpayment, we ask you to pay it back. Number two, the governor made a decision, and actually I very much support the governor, and that is a lot of people were in the queue waiting to go through. They couldn't get their hearings, right? So the governor said, just pay them, and we'll clean it up later on, right? That helped hundreds of thousands in Virginia get their payments. The governor could never have done that under this bill, because under this bill, it says that if you overpay someone, you can't get it back. So the governor's action, which was to go ahead and pay them, if we overpay them, we'll get it back, can't happen under this bill. And even though the governor made that action under this bill, we're not going to be able to get back the money that's there. So employers...
Senator Newman, if I may clarify, first, I would note that the standards for overpayment waivers that we're codifying here in Virginia law are already the federal standards for overpayment waivers. 40 other states also have standards that are similar to this one. Here's the difference between what we'd be doing and what you just described. It's not that you can't collect any overpayment. You can still collect overpayments that are due to fraud, and you can still collect overpayments where it's feasible to the state to do so without depriving the claimant of basic necessities like shelter, food, and medicine. The problem that we want to prevent is having someone reach out for help after they lose their job, have the state send them money by mistake, and then have the state issue them a notice that they now owe back several $1,000s while they are still unemployed and have no capacity to repay. VEC will tell you, and I know that they should be here to testify, that the administrative expense of trying to recover these payments simply isn't worth it because the people don't have the money to pay back. And you're adding enormous stress to the claimants because they've lost their job, they're still out of work, they simply don't have the capacity to repay. So we're not doing anything unusual here. As I said, 40 other states still implement this standard.
Mr. Chairman, that's
Senator Newman.
I respect the delegate. I think she's very bright, but I've talked to the VEC, and the fact is that we have today the ability to go back and receive back payments under the federal policies. We can do that today, and almost all states are doing that. What we're giving them here is the ability, as long as you didn't commit fraud, none of that repayment will come back to the state. It'll go into the fund, and corporations are going to have to pay for this. That's all there is to it. Right now, they're going to pay $200 million as the guesstimate, and it's going to go up again if we do it this way. So hopefully
Mr.
the
Chair,
VEC
Senator
will be
Newman,
able to...
you'll notice on the fiscal impact statement that there's no
Mr. Chairman,
Senator Newman.
So I hope it will have someone on the VEC to help us with this information, because that's not the information that I've seen or what I've heard in the VEC.
Mr. Chairman.
Mr. Chair, Jason Paget from the VEC should be here. He's their policy director. We've worked very closely together on this bill.
Mr. Chairman. Spruill.
Senator Spruill.
I thought what Senator Newman was talking about, this fraud, and from this bill would be safeguard that will prevent from fraud. So I don't see what the problem with this bill, because I'm aware of the millions of dollars that we lost behind fraud. But if this bill will safeguard that, I don't see why we can't get it out. Thank you.
Mr. Chairman.
Senator Bell.
I don't know if the patron can address this or VEC, but in the fiscal impact, I see it's about a $50 million hit on the trust fund. I'm a little concerned about that. Could somebody address that?
Well, it has to go to finance.
Mr. Chair, Senator Bell, I know that there have been several fiscal impact statements. I want to make sure that we're at least looking at the most current one together.
This is the one that the most recent one I can see. It's 2022 in the trust fund, $18,723,000, and then it goes $6.3 million every year after that, and then the general fund would be $250,000 a year starting in 2022. Is that correct?
Mr. Chair, Senator Bell, yes, that is the current fiscal impact statement. If I can speak first to the general fund issues, I think we do know that VEC needs additional personnel to process the backlog of claims. So that's what the $250,000 would be doing is FTEs. I know that the House had already planned to allocate additional money to VEC to help process claims given the challenges there. So that's what that's for. And then, yes, it is the case that there would be an $18 million outlay in order to cover overpayments. That does tell you how many people have received these checks that they simply can't afford to pay back. But to scale that number, it's worth noting that this time last year, the trust fund balance for the unemployment fund was about $1.5 billion. So $18 million is a drop in the bucket that we have to fill. I will note that the governor's office has asked me to chair a work group in the coming year on refilling the trust fund. And so I will definitely be assuming responsibility for the downstream consequences of passing this bill. I think it's important that as we fill the trust fund, we do it with a fair eye toward the people who have been unduly burdened by the administrative errors of the state.
Mr. Chairman, if I could do a follow-up question.
Senator.
I thank the patron. That's a great answer. What would be helpful in this is, do you have any kind of historical perspective on, say, for instance, the 18 million, how much was recovered? Because I know your previous statement was a lot of it wasn't covered. And I know that there's a cost of recovery, but do you have any percentage of what they typically recover on overpayments?
Mr. Chair, Senator Bell, I think that it would be difficult to say, given that past overpayment recoveries have primarily focused on people with the ability to pay, and what these waivers would offer protection for people who effectively have no ability to pay. And so I'm not sure that retrospective data would be indicative of the consequences of this, and I don't have the disaggregated numbers close at hand. I do think that it's just helpful to keep the case study in mind. You're imagining a person who applied for unemployment compensation during the early days of the recession, when there was a lot of confusion about qualification through both the state and federal programs. And so they applied in good faith. They committed no fraud. They received benefits for several months and used them to pay for rent and gas and groceries. And then 5 months later, got a very scary letter from the state that said, you now owe $10,000 back that you don't have. And so in addition to suffering the economic fallout of the recession, you are now in debt to the state because the state made a mistake. And I think it's important that rather than put that burden on the individual worker who has no capacity to repay, that we instead invest in systems at the VEC to ensure that fewer of those mistakes are made in the first place. That's why I've also been invested in modernizing the VEC's technology and adding additional personnel. I filed a budget amendment to do just that. So I think that overpayments waivers solve a particularly acute problem for the people who suffer from them, and that the solution to the problem lies further upstream in the administration of the agency.
Okay. All right.
Mr. Chairman.
Senator Newman.
Just the last thing. I really think this sends the wrong message that we're going to tell someone that if they got an overpayment, that they don't have to pay it back. Here again, we don't even do that in TANF. But if we do, I sure hope it doesn't go to the trust fund. Those employers didn't err here. That should be a general fund. We should pay for it. It should be, if it's going to be assistance to Virginians, we ought to put it into the budget and we ought to do it. We ought not put it on the backs of businesses.
Well, it's got to go to finance if it gets out here. Anybody in the pipeline?
Mr. Chairman, we have 3 speakers with their hands raised, as well as Jason Padgett from VEC.
Okay. Try to limit your time to 30 seconds each. First up.
Jason, feel free to go ahead.
Sure. Mr. Chairman, Jason Padgett, VEC. We have no position on the bill. I'm just here if there are any additional questions.
Okay.
Mr. Chairman, I've got a couple for him. Mason.
Senator
Thank you.
Mason.
Sir, you heard Senator Bell ask the question about recovery. Do you have any, and the Delegate Hudson said that retroactively might not be useful in this situation. Do you have any idea, how much of this money would be recoverable?
Mr. Chairman, I would point to the fiscal impact statement. I can say in the previous calendar year, we had about a 50% recovery rate. But that does change every quarter based on the overpayments and then the recollection of overpayments. And the agency does go back 7 years to recover overpayments.
Thank you, Mr. Chairman. Another one, please. So you could conceivably get $9 million of that back based on past information. So I think everyone understands what Delegate Hudson's trying to do. You have someone in a really bad fiscal situation, no job. Last thing you want to do is to send them a bill in 3 months and say, hey, you owe us $9,000. Is there a way to stretch it out? I mean, because what we don't want is everyone in this circumstance making this claim. Hey, I'm in a bad way, I can't pay it back. But certainly some of these folks will recover and get new jobs in the future and be able to maybe stage some sort of recovery plan. Do you have any idea on how we could work that rather than just a completely open-ended plan?
Mr. Chairman, right offhand, that would take something that would take more research and look. On short notice, is difficult to answer.
Mr. Chairman?
Mr. Chair, Senator Mason, I would just add that that would throw us out of line with the 40 other states that already implement the simple waiver system. So that would be something rather novel. Other states have all managed to do this.
Mr. Chairman?
Thank you.
Spruill, I'm trying to figure out, we are concentrating on getting the money back. What about when the money is given out? I'm trying to figure out why we can't come up with a way of not making a mistake that you send someone all this money, and then you realize 3 or 4 months that we made a mistake by sending them this money, and now we're going to ask them to pay it back. They're in a hardship as it is, and we give them this money because they think that they deserve the money, and we think they deserve the money. We gave it to them, and now all of a sudden we made a mistake. And that's it. And so how can they pay it back if we made a mistake? So I'm hoping, Mr. Chairman, that instead of we waiting about trying to get it back, we should make sure that when we give the money out that we are doing it right and not make a mistake and giving money out to someone that don't deserve it. So it's not their fault that we make a mistake giving this money out. So I'm going to support the bill.
Mr. Chair, I would just agree with Senator Spruill. I think that's where the state should be investing its time in solving the problem.
Next, we have Conrad Buckler.
Yes, I am Conrad Buckler, a senior economist at the Virginia Employment Commission. I primarily deal with the trust fund. So in response to the question, to give you a little bit more historical evidence, typically in a typical year, overpayments account for less than 5% of the total benefits that are paid out. And we do offer payment plans, but given the nature of this pandemic, most of the people who have been receiving benefits are on the lower income spectrum, because it's even reflected in the average weekly benefit amount is significantly less during the pandemic than it has been in normal times. So the money that we will be trying to recover, we don't expect to get the same repayment rate that we would in a typical year, because it's totally different circumstances. It's highly unlikely that we will get anything approaching 50% with the overpayments that have been due to the pandemic.
Learn how to stop overpaying poor folks.
Mr. Chairman. Monty.
Monty. Senator Mason.
Thank you, sir. You said in a standard year, overpayments about 5%. What are we tracking during the pandemic, percentage-wise?
Well, we don't have full accounting of the pandemic since we are still in it.
Yes, sir. But year to date, what you got?
Year to date, it was, the last that I saw, total overpayments were accounted around 27 million, but that includes fraud. And so it's not for the provisions of the bill. When we did a test of what the bill would actually forgive, it was similar to around 18 to 20% of all overpayments. So of the overpayments we get, a minority of them are administrative related or would be affected by this bill that would fall under the provisions where they could apply for the waiver.
Mr. Chair.
Thank you, sir.
Mr. Chair, of that 27 million, what percentage of that is that? What percentage of your total payments is that?
27 million of this last year is right around 1.6, 1.7 billion. That 27 million in overpayments that we've got thus far, we've paid from regular UI right around 1.7 billion thus far.
So that's substantially less than 5%.
Oh, yeah.
I would also add, Mr. Chair and Senator Deeds, that the VEC will already be shouldering the administrative burden of administering these waivers for the federal part of the system. So this would simply align the state portion of unemployment with that federal standard.
Mr. Chair.
Senator Deeds.
My take is if 40 other states are doing this, and we're really talking about people who are getting benefits through no fault of their own, we ought to try to find a way to get this done. And I'd move to report and re-refer to finance.
And I second.
All right, the motion is to report and refer to finance.
Mr. Chairman, could I speak to the motion?
Sure.
Mr. Chairman, I don't think that this bill even has a sunset clause on it. So this is going to be the policy forever. If we got through COVID and we did things fast, that's one thing. But as I understand the bill, the way it's written, this is forever. We're going to do this forever. So whether this occurs 5 years from now, in a time it's not COVID, whenever it is, we're going to actually change the policy. Mr. Chairman, I don't know if we do that here or upstairs, but that's one of the reasons why I struggle with the bill.
Mr. Chairman.
There's
Chairman.
a couple of speakers.
Yo. Mr. Chairman, over here. Lewis.
Senator Lewis.
To Senator Newman's point, I looked at the enactment clause, and I read the enactment clause as having a start and end date for this new overpayment plan, overpayment policy. Can somebody answer that for me? Is that correct?
Mr. Chair, Senator Lewis.
Yes.
There is a portion of the enactment clause which would allow for retroactive payments to people during this COVID period. So from March 15th of last year on through the end of June of this current year. But Mr. Senator Newman is correct that it would now be the policy of the Commonwealth going forward to continue to apply the standard that 40 other states do.
Okay, I'm sorry, I misread it. Thank you.
All right, there's been a motion to report and refer to finance. Oh, hold on, there's a couple more to speak. How many?
Mr. Chairman, we have 3 speakers left, starting with Pat Lavelle.
All right, try to wrap it up in 15 seconds, whether you're just for or against it.
Good afternoon, Mr. Chair, committee members. I'm Pat Levy-Lavelle, an attorney with Legal Aid Justice Center. We support this bill because it makes the unemployment system work better for workers. As to the waiver provision, it's critical to know, as Delegate Hudson mentioned, that 40 other states are doing this on a permanent basis. The vast majority of overpayments under this standard are not subject to waiver. This excludes a small fraction in situations where the claim is not at fault.
Okay.
Thank you.
Next.
Jody Roth.
Ms. Roth, welcome.
Hi, Mr. Chairman, members of the committee. I apologize. I'm not able to undo my camera. I don't know why, but I just, on behalf of Virginia Retail Federation, we do oppose this bill.
Next.
Nicole Riley.
Ms. Riley, welcome.
Thank you, Mr. Chairman and members of the committee. Nicole Riley with NFIB. We still have concerns, mostly because at this point we are trying to put in this policy during a pandemic. While, when the trust fund is flush with money, this might not have as big of an impact, but we do know that employers are going to be seeing the rebuilder tax coming. Their experience rating will be going up for those who have had layoffs. And so we just would ask that everyone maybe pause and do a deeper dive on what kind of impact this would have. Thank you.
And Mr. Chairman, the final speaker is Doris Mays.
Yes, Mr. Chairman and members of the committee. My name is Doris Krause Mays with the Virginia AFL-CIO, and we are in support of this bill. And I think the delegate has narrowed it down to make it specific, laying it out. So again, I would ask that you pass the bill. Thank you.
Bill has to go to finance. All right, there's a motion, report, and refer to finance. Any discussion? All right. All those in favor of reporting and referring to finance, vote aye.
Okay.
Ayes 12, noes 2.
Ayes 12, noes 2. I might note that quick calculation is that their overpayment was 1.5% of the total. All right, is there any other comments? I think we have finished the calendar. And if there are no comments, then the committee will rise. Thank you.